Hi all. Today the topic is COPD exacerbation versus acute respiratory failure. So PDX selection plus coding guidelines. Most of the coders they don't know how to fix the PDX for these scenarios. So today we are going to discuss about this topic. Shall we start? When both conditions present on admission, main question for coders: which condition meets principal diagnosis? Follow. As per the UHDDS definition, AHA coding clinic guidance, clinical indicators plus treatment focus, the PDX selections logic most important. Give PDX acute respiratory failure when severe hypoxia, hypercapnia, patient in respiratory distress requires oxygen high flow, NRBM, ventilator, BiPAP, CPAP, intensive care unit, documentation, acute respiratory failure clearly documented. On this time only we have to give acute respiratory as PDX. Then next, give PDX COPD exacerbation when mild moderate respiratory symptoms, no clear respiratory failure documented, treatment mainly for COPD exacerbations, the treatment like nebulizers, steroids, antibiotics. AHA coding clinic criteria if both conditions documented. Sequences based on reason for admission, severity of condition, resource of utilization. If respiratory failure usually takes priority because life-threatening condition it is. Medications to check very important for COPD exacerbation like bronchodilators, albuterol or ipratropium. Steroids IV or oral. Antibiotics if infection is present. For respiratory failure, oxygen therapy, BiPAP, CPAP, mechanical ventilation, sedation if intubated. Therapeutic treatment like oxygen supplements, nebulization therapy, ventilation support, NIV, invasive, pulmonary rehab support. Next, diagnostic details to check ABG, arterial blood gas, PaO2 hypoxia, PaCO2 hypercapnia, pulse oximetry, chest X-ray, CT chest if done, labs, WBC, infection markers. What coder must check in record? Documentation checklist like admission note, reason for admission, ED note, initial severity, H&P, diagnosis clarity, progress note, treatment focus, ABG reports, confirm acute respiratory failure, discharge summary, how to check for final diagnosis, whether it is acute respiratory failure or COPD exacerbation. ICD 10 coding examples. Scenario 1, PDX should be J9601. First we discussed, right? That one is acute respiratory failure with hypoxia. SJX will be COPD exacerbation J44.1. Scenario 2, mild case. PDX is COPD exacerbation because only treatment is dosed for COPD exacerbation only. SJX is J9601 if it is mild only. DRG assignment. When acute respiratory failure as a PDX, the DRG goes to 189. Then COPD exacerbation goes to PDX, the DRG will be 190 with CC. Without CC, 191. Final coding rule. Interview gold opportunity for ask yourself which condition, cause or admission, require more resources, is life-threatening condition. Answer PDX. Pro coder tip: never code based on only diagnosis list. Always code based on clinical indicators, treatment intensity, physical documentation, physician documentation only. So, okay, guys, today we are discussing about these conditions. Guys, tomorrow we are going to discuss about in GA bleed and acute anemia. Okay, thank you, thank you.